start off by saying that much of what I will say today has been published in a commentary recently, which was co-authored by my and as pointed out already by Philip and others, much of the discussion is focused, I think, on the development of new drugs and antibiotic R&D. Well, in fact, most of the newer drugs are focused on multi-drug resistant pathogens and very quickly ill patients, so they're only available probably for the near future as IV therapy, and they're very broad spectrum drugs. In clinical practice, however, most of our infections aren't that critically ill, and they are infected by bacteria that are still susceptible to available antibiotics. So, in fact, the older drugs are usually preferable because they have a more narrow bacterial spectrum. They have a low risk of resistance development, low risk of side effects usually, and they are more often available for oral therapy. So it would make sense to make sure that these are available also. This is the topic of my presentation today. And as you are well aware, we have an unequal distribution of antibiotics over the world. So in some countries, there's a huge lack of effective medicines. But also, if you look more closely in the same region or continent, you will also find unexpectedly great variations in availability of specific antibiotics. So in one survey recently, it was shown that more than half of the selected generic antibiotics were available in less than half of the countries. And the reasons behind this are obviously not medical, and it's not based on resistance rates, but there are other factors driving this. And so in recent years, we have experienced more and more shortages of antibiotics, and it seems that they are more often in shortage than other types of medicines for some reason. We have a long list of local and national shortages affecting first-line treatment options, and whether it's local or national will depend on how you buy your antibiotics and how your agreement looks like. But then we have also this example of piperacillin tazobactam that I'm sure many of you are aware of, where this is really an important antibiotic which is used a lot in the emergency room and in hospitals to treat severely ill patients. And what we experienced last year was a global shortage of this drug that seemed to have resulted from damage to a single factory in China. So, I mean, for me it's just unbelievable when you look at it, that the whole world depends on a single factory to produce one of the most important antibiotics. Right? So just to illustrate the consequences in clinical practice, imagine we have severely ill patients with suspected sepsis in the emergency room that would normally be treated with piperacillin tazobactam. And now that this drug was on shortage, we had to look for all other alternatives. And basically you have two options. Either you could choose a more narrow spectrum antibiotic, taking a risk of the bacteria being resistant to this drug and a high risk of treatment failure. And the other option would be to go for a broader spectrum drug or a drug with a higher toxicity. And that way you're very likely to treat the patient, but you risk more side effects and you risk to create more resistance problems in the future. And another type of patients that we have a big problem with right now in Sweden is children with urinary tract infections, where we lost our only oral antibiotic for febrile urinary tract infection last year for financial reasons, so it's no longer available. And the other two drugs that we normally use were on shortage simultaneously for a prolonged duration of 3 to 6 months this spring. And so what can you do? The only option for us was to put a needle in his arm and treat with intravenous cephalosporins. So this doesn't make sense to me. How did we end up here? So just to summarize, the consequences of shortages is that you have to use the second best option, because the first line option is always there for a reason, right? It's considered to be the best available treatment. So if you don't have that, you always end up with a second best option with a high risk of treatment failure, toxicity, or resistance development. And this will obviously, as in the case with this small kit also mean higher costs for both the patient and society and healthcare. There are probably several reasons for this. Economical reasons are probably very important, but there's also a problem with manufacturing quality in some factories, and there seems we have very, very few producers of antibiotics worldwide. And bottom line is that the system is just too fragile. We have a business model that has failed to produce new antibiotics, but also failed to ensure that we have equal distribution of drugs and availability of the drugs. So what you'd like to do first is to map how the current production and supply chains look like, which has turned out to be really difficult because there is no transparency. When making agreements on antibiotics, we shouldn't just ask for a fair price, but we have to also consider the insurance of continued production and stock management. And collaboration between different countries is obviously helpful also in this problem. So to conclude, all antibiotics are still essential to provide the best available treatment, and in fact we depend on them every day. Shortages add to the burden of resistance and very few antibiotics in the pipeline, and to me it's just an unnecessary problem that we should be able to fix. We need to do something about it, and you probably need to start off by creating a working group to dig deeper into this problem, try to get the information that has to be out there about the production and supply chains in order to find where the problems are and what are the best solutions. So with that, I'll stop. Thank you.
Thanks very much, Thomas. If you can remain now, we do have just a couple of minutes before morning tea. I wonder if somebody would like to ask a question or a comment, and coming back from the previous panel as well. So the first one here, and then I'll go back to over here. So, Gary.
You mentioned the discontinuance of one drug for financial reasons. Could you explain what those financial reasons are?
Yeah. So the information I got is that there was a manufacturing problem with the only existing factory, which was somewhere in Asia, and so the company considered to do some investments in that factory or another factory in Europe, but they just ended up saying that it was too expensive, and the market was too small.
So we'll just take the microphone to the question here, and then if you can pass it across.
Thank you. Good morning. My name is Tängdén of I'm the coordinator of the Safer World Network for Pandemic Preparedness. My question is, or comments, if you can talk about generic medicines to counter these shortages of antibiotics, and if somebody also can highlight the use of life-saving antibiotics in conflict or war zone areas, how we can ensure the access and availability.
Thank you very much.
I didn't understand the first part of the question.
Generic.
Yeah.
Antibiotics, because you talked about one producer and the shortage of production. So do you see that promoting generic medications could be the answer to this?
Yeah, but, what I think is most important in this is well, I'm not that interested in discussing prices, so just increasing the prices won't solve the problem. And whether it's called generic or, I mean, the label is not important to me, but you have to go to the basic stuff. How many factories are there? I mean, it's something you're not, I mean, you cannot easily understand how few producers there are at the beginning, because then they all spread out and they have multiple manufacturers and providers. So that's the difficult part for me. And then definitely this is, I mean, I'm just highlighting a very new problem for our country. So definitely availability of antibiotics is a bigger issue in other countries, and I acknowledge in war zones and other places you have a very different problem. But this is just to illustrate a new phenomenon that we haven't seen before.
I don't think we really have time to go into detail around war zones. I think it's a really important issue you've raised, and I think it's one that perhaps could be discussed, and certainly during the day at lunch and morning tea.
Yeah, Philip from FIP. So FIP have pulled together a report on models and tactical options for shortages. So I would suggest looking at the FIP.org website. The impact in the UK of the pit potato shortage was unbelievable. We actually ended up having to use some of our pandemic reserves of other antibiotics. It cost £31 million to actually cover a 3-month shortage of piperacillin and tazobactam, which is an enormous amount of money. There is currently an EU Cooperation and Science Technology work stream looking at medicine shortages at the moment. And we're working with Estimate looking at vaccines and antimicrobial shortages. So there's a survey going out globally at the moment asking prescribers about the impact, but also at a country level about what is actually in place to tell prescribers about shortages and strategies to deal with it. So I'll be more than happy to share the links out if you want to take part.
I think we'll take that as a comment.
Okay.
Thank you very much, and I'll go to Peter at the back.
Yeah, thank you. This is also a comment or maybe a response, because as you already said, this is also at the agenda of the World Health Assembly. We have a group of colleagues working on shortages, which is a big issue not only for antibiotics but also for other old drugs, because we see that when generic companies review their portfolio and they list out drugs that they have low profit margin, small volume, we are using essential drugs every year. And we are going to do this specifically for antibiotics and hopefully going to convene such a working group towards the end of the year with support from Sweden to look, we have done the analysis, what are the antibiotics we think are most at risk, and then looking actually into possible solutions. And I would be very interested in the paper that Philip mentioned. And I also agree with Philip, it's very difficult to actually figure out where the suppliers get their API from, because that is not is information that is not publicly available and the companies are not necessarily willing to share. So we also have to do more studies around how the production landscape looks like, but I do think we also have, in Europe for example, we have to do more demand forecast and to see, what is the volume to make the market more predictable for actually the companies that work quite well in HIV. In HIV, for example, we organize every year a specific meeting with all the companies to predict, to do demand forecasting. What is the HIV treatments we recommend? What is likely to be the volume, so that they actually can production and they also can see how the market is going to look like.
I will even add a complexity that we also have World Trade Organization intellectual property issues that become involved in these sorts of issues as well, make it even more complex. And I think for us, we need to keep in mind the importance of the public's health first and foremost, and that's what Thomas has been giving us. Thomas, do you have any final comment?
No, but I'm very happy to hear this, and I know that WHO and others are acknowledging this problem now, which is really good. I think the transparency is the first problem to solve. How can you really get the information? It has to be out there somewhere, but it's just not by regulations open for us. So I'm looking forward to this and see what's happening.
Can we hear appropriate thank you for Thomas? Thank you.